Hi guys, today we're going to talk about why you probably don't need that Z-Pack. This time of year, I get so many calls at the office of people just saying, I think my allergies are bothering me, or I have a cold and I really need a Z-Pack. Well, for those of you who don't know, a Z-Pack is a 5-day antibiotic, Azithromycin, and it kills bacteria. So if it's just your allergies, antibiotics aren't going to work for that. If it's a virus, antibiotics aren't going to work for that. And so let's break it down a little bit and go through the science of this. This time of year, what we're really seeing the most of, January, February, etc., we see a lot of COVID and tons of flu and some RSV. Certainly there are cases of bacterial infections out there, but they're not nearly as common this time of year. A lot of times when people call the office, I'll say, I really want to get a flu and COVID test on you. I really want to know what symptoms people are having, because that helps me determine, is this more likely a virus versus a sinus infection versus strep throat. And so sometimes people feel like we're not wanting to treat them. That's not the case at all. What we want is to treat you with the right kind of medicine. So when they ask you for more information, going by what you have really is very helpful to determine the best course for you.
I think I'm getting the black lung, Bob.
Sometimes people want to send a picture of their mucus. No, thank you. Describe it to me. I'm good with that. We're going to have a whole bit on that later. But also, if you're having body aches, if you are running a temp, that is more likely some sort of a viral infection, probably not a sinus infection. And so when people say, oh, I have yellow snot and I'm running a low-grade temp, I think, I'm really thinking more along the lines of COVID or flu. So approach your doctor and tell them what's going on. And, maybe an antibiotic isn't the most appropriate thing, but help us decide what is going to be best. And let's also not kill off the good bacteria in your system, because that's one of the collateral damages that we do when we prescribe an antibiotic that someone doesn't need. And we do not want the superbug. That's bad, bad, bad. Were you around somebody at work who had a sinus infection and then you got the same symptoms as them? They didn't have a sinus infection. They had some sort of an upper respiratory infection that might have involved their sinuses, but that's not generally bacterial. Viruses are way more contagious, and you don't pass around a sinus infection. You can pass around all that other stuff. If you have somebody who knows that they had the flu or knows that they had COVID and you had a particular exposure to that, that's very helpful too. If you are around somebody who had some sort of bacterial infection like meningitis, we certainly want to know about that, because that can be deadly and hours count. But most of the time, just listen to what your doctor's telling you. I realize it's a very unpopular stance to have, but it also happens to be the truth in many cases. So when in doubt, go see your doctor. Go get tested so you'll know what's the right medicine for you, and be healthy and happy this winter.